You know, inside every single one of us, there's a process that's designed to save our lives. But in a split second, it can turn deadly. Today, we're diving into the incredibly high-stakes fight against these killer blood clots and the really powerful drugs that we've developed to stop them dead in their tracks.
So let's just jump right in with a huge question. What do two of the most terrifying medical emergencies out there, a heart attack and an ischemic stroke, the kind caused by a blockage, what do they have in common?
The answer, and it's kind of shocking when you think about it, is just one single tiny rogue blood clot. A biological process that's meant to heal us can, when it just happens in the wrong place at the wrong time, become a killer.
Now normally, clotting is our best friend, right? You get a cut, and these little cells called platelets rush to the scene, they form a plug, and you stop bleeding. It's an absolutely brilliant healing mechanism. But what happens when that exact same process gets triggered inside one of your most critical arteries?
Well, that's a condition called arterial thrombosis. A clot forms where it really shouldn't, and it basically creates a massive roadblock on the superhighways of our circulatory system. If that road leads to your heart muscle, that's a heart attack. If it leads to your brain, that's an ischemic stroke. So how on earth does medicine even begin to fight back?
Well, modern medicine has come up with two main strategies, two totally different battle plans. Think of it like a potential traffic jam. Strategy 1 is all about preventing the cars from piling up in the first place. We'll call them the prevention squad. Strategy 2 is for when that jam's already happened. You got to send in the heavy-duty tow trucks to clear the road fast. And those are our clot busters.
All right, let's meet that first line of defense, the prevention squad. These are a class of drugs you may have heard of. They're called antiplatelets.
Their job is actually pretty simple, but it's totally ingenious. See, platelets are the first responders to an injury, but in arterial disease, they can get a little overzealous. Antiplatelet drugs basically tell them to just calm down, to chill out, making them less sticky so they can't all clump together and start that dangerous pileup.
Now, within this prevention squad, there are several key players, and each one has its own unique way of keeping those platelets in check. Let's meet the big three.
So first up is a name everybody knows, aspirin. You probably think of it for headaches or a fever, but in the world of cardiology, it is an absolute cornerstone of antiplatelet therapy. And what's wild is that its life-saving ability to prevent clots, that was discovered almost by accident decades after people first started using it for pain. So how does this common little pill do such a powerful job?
Okay, this shows aspirin's tactical genius. Normally, platelets send out the sticky signal called thromboxane A2. It's like a call to arms for all the other platelets to come join the party. But then, aspirin shows up. It permanently blocks the COX-1 enzyme, which is the factory making that signal. So the signal factory gets shut down. The result? The platelets just can't clump together anymore. For the entire 10-day lifespan of that platelet, it has been totally silenced.
All right, next up on the team are the P2Y12 inhibitors. Now, these drugs take a completely different approach. Instead of cutting the signal wire like aspirin does, they basically plug the ears of the other platelets so they can't even hear the call to action in the first place. And this is a really key distinction. Some of them, like a drug called Clopidogrel, are irreversible. They're like putting in earplugs that last for the platelet's entire life. But others, like Ticagrelor, are reversible. They're more like noise-canceling headphones that you can take off. This gives doctors a ton of flexibility, especially if a patient suddenly needs surgery and has to get their clotting function back online quickly. And finally, we have the real heavy hitters of the prevention squad, the GP2B/3A inhibitors. Now, these are not for your daily prevention. These are the special forces that get called in only for the most high-stakes emergencies. Yeah, think of these drugs as the emergency brake. They block the final, critical step, the actual physical linking of platelets together. They are incredibly powerful, so powerful, they're only given through an IV during an emergency like a heart attack. But, and this is a huge but, with that kind of power comes some very serious risk, especially severe uncontrolled bleeding.
Okay, so that's prevention. But what if the clot is already formed? The road is completely blocked, traffic is backing up for miles, and things are getting critical. Well, it's time to call in our second squad, the clot busters, or as they're officially known, thrombolytics.
So unlike the antiplatelets, which just prevent the pileup, thrombolytics are designed to completely dismantle it. They don't just stop the clot from getting bigger. They actively dissolve the structure that's already there. And they do it by basically turbocharging our body's own natural clot-dissolving system.
And get this, the very first one of these drugs was actually derived from bacteria.
Let's walk through how this works. First, you've got a dangerous clot blocking a vessel. Then, the thrombolytic drug is given. This drug finds a sleepy, inactive enzyme in our blood called plasminogen and flips a switch, turning it into active plasmin. And plasmin is like a molecular Pac-Man. It just goes to work, chomping up the fibrin mesh that's holding the whole clot together. The clot dissolves, and blood flow is restored.
But here is the single most critical thing to understand about thrombolytics. The clock is everything. I mean, for an ischemic stroke, the window to use these drugs can be as short as 3 hours from when the symptoms start. For a heart attack, every single minute of delay means more precious heart muscle is dying. This is exactly why you hear time is brain or time is muscle. Recognizing symptoms and getting help immediately is absolutely vital.
And this brings us right to the central theme of this whole story. You know, using these incredibly powerful drugs isn't some simple, straightforward decision. It is a constant, delicate, high-wire balancing act.
On one side of the scale, you have this unbelievable benefit, saving someone's life by stopping a deadly clot. But on the other side, you have the inevitable risk, causing a dangerous bleed. For antiplatelets, that might be things like bleeding in the stomach. But for the super powerful thrombolytics, the risk is a major hemorrhage, including the one complication everyone fears most, bleeding inside the brain.
This quote from the research really says it all. The very power that makes these drugs lifesavers is the exact same thing that makes them so dangerous. It's a true double-edged sword that doctors have to handle with incredible care, precision, and judgment every single time.
So this whole war on clots is a constant high-wire act. Every decision is a knife-edge calculation of risk versus reward. And it really leaves us with the central question for both doctors and their patients: how do you perfectly balance stopping a clot that could kill you without starting a bleed that could do the exact same thing? It's a challenge that defines modern medicine, and one where the stakes couldn't possibly be higher.